never want to see our Furever friends suffer. Would you be able to differentiate between when your dog has fainted versus when it may be experiencing a seizure? Well, one veterinarian at the University of Illinois Veterinary Teaching Hospital is hoping to figure that all out. Dr. Erica Fox, as well as Luna, are hanging out with us this afternoon. Welcome to both of you.
Thank you. Thanks for having us.
Okay, first tell us about Luna.
Yeah, so Luna is an older Siberian Husky. She belongs to one of our client service representatives, Emily, and she has kindly volunteered her to come on the show today.
Well, yes, we love our little furry friends here hanging out with us. Now, the topic of the day is seizures versus fainting. Now, luckily, Luna isn't suffering from either one of those things, but why are you doing this study?
Yeah, so very commonly dogs will present to our ER and ERs around the country for loss of consciousness events, so meaning either seizures or syncopal type events where they faint and lose consciousness temporarily. It's often hard for veterinarians on that point of care setting to determine whether it's a seizure or a fainting event, and therefore it can make it hard for us to point towards a neurological cause or potentially a cardiac cause of these loss of consciousness events. So our study aims to use blood biomarkers to try to distinguish between these events in a point of care setting and make it easier for doctors to discern.
Yeah. Okay, so we're looking here at some of the things that people need to know. They will have blood samples collected. Is it like every couple hours?
Yeah, so they'll have a blood sample taken on admission, 1 hour, 2 hours, and 4 hours.
Now, when you're saying upon admission, are they being admitted because they had just had a seizure or had fainted, or is it just, okay, my dog has done this in the past, I'm kind of curious if that's what it was, but they have to have had it like within the hour or so?
Yeah, that's correct. We want them to have had a seizure or a fainting event within the past 3 hours prior to coming to our ER.
Okay, so then during the course of the time that they're with you, you'll be drawing blood samples. What else are you going to be doing?
Yeah, so we'll do a full neurology exam on them. We'll take a blood pressure, we'll do an echocardiogram as well, and we'll do a full physical exam as well, of course.
Okay, who would not be a good candidate for this?
So dogs that have any prior history of liver disease, or dogs who are having focal seizures, meaning facial twitching and not losing consciousness during those seizures, are unfortunately excluded from our study.
Okay, I guess from my past experience with having a dog who had seizures, you could tell that's what that was. It wasn't just like a falling over type thing.
Yeah.
So I guess I didn't realize there were other type of seizures.
Yeah, so there's lots of different types of seizures. We think of full body seizures, or what we call focal seizures or partial seizures, where they're just having little facial twitches often.
Okay, and so then once you get the results, there you go, you're off to work, yes?
Exactly, yeah, so they really only have to stay for 4 hours, and then they can go home after that. There's no further follow-up required.
Okay, so how long are you going to be participating in trying to gather your data?
Yeah, so we're aiming to enroll 34 total patients in our study, so 17 seizure patients and 17 fainting patients. We're collecting data until July of 2025.
Okay, is there a certain breed of dog that seems more common that you're seeing there in the ER over others?
Good question. Yeah, we think of all breeds being affected with different types of epilepsies, but recently we've seen a lot of St. Bernards. So
maybe larger breeds?
Yeah, I would say a lot of large breed dogs.
Interesting.
Yeah.
Okay, well, if somebody's out there and they've had this experience with their pet, this would be a great opportunity to help you learn more.
Absolutely.
And then we can come up with a game plan for how to help our furry friends. What's the best way for people to contact you, maybe reach out, learn more if they want to participate?
So they can reach out to the hospital via my email, efox@illinois.edu, or they can give us a shout at the main hospital line as well.
Okay, well, we're happy to hear that Luna is seizure-free, faint-free, and thank you so much for bringing her and introducing us and letting us know about this study happening there at the U of I. If you want to learn more, maybe this is something that's affecting your pet, we will have all of the details on the study and how you can connect with Dr. Fox at our website, stayliving.tv, after today's show.